truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office, experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all, in-depth discussions.
Breaking it down into simple terms. We hold
these truths.
We hold these truths.
With Dan Crenshaw.
The Eagle has landed.
Welcome back, everybody. We've talked about this on this podcast before. Gender affirming care. It's kind of new thing, newish, that has certainly swept liberal ideology. But that has real consequences for young teens, adults, everybody from every corner of our society. And what's more problematic is our most cherished and trusted institutions, children's hospitals, universities, medical associations that are promoting the idea of gender affirming care. And someone might ask, what's the science behind this? What is where's the evidence that this is something that we should really be promoting and defaulting to, because it has real consequences. And a few months ago on the E&C committee, or Energy and Commerce Committee, which deals with healthcare issues related to Medicare and Medicaid, and we had a witness, and she was a doctor from Yale who promotes gender transitions for children. This idea that you should default to gender affirming care as opposed to, ask questions about why they might feel a certain way. She was opposing a new bill that I introduced, which would withhold funding from children's hospitals that offer gender transition services. That bill is, we're passed it out of committee. We're still hoping to somehow make it into law. But she kept repeating these the same words over and over again. She said, I said, well, where's the evidence? She said, it's standards of care. But she couldn't say where those standards actually came from. Standards, of course, have a definition, and that definition is, a set of standards based on some kind of body of evidence that created the standard in the first place. She couldn't reference anything. The other witness on that panel was also Dr. Miriam Grossman, who I'm honored to have on my show today. She has really led the way in, I think, unpacking a lot of the data and just revealed the dangerous ideology that has infiltrated her field of pediatric medicine and the harmful falsehoods that are adversely impacting children. So, Dr. Grossman, thank you for being on.
Oh, Congressman Crenshaw, it's really my honor. I'm so happy to be here with you. And I want to just start off by thanking you for your service to this country and for all the work that you've done in Congress about this subject of transgenderism and the dangers of gender affirming care.
I said this was kind of a new phenomenon, but you actually wrote your book on this. You're Teaching My Child What is what the name of the book. That was in 2009.
That's right. I wrote a book about sex education and how sex education in this country is animated by ideology and not by science. And yeah, that came out in 2009. In fact, it just came out in paperback last week. You're Teaching My Child What? And in that book, you see, when I was researching that book, I came across this stuff about gender. And it was really kind of standardized part of sex education as presented by Planned Parenthood, SIECUS, and other large for-profit organizations that receive tons of taxpayer funds. And these organizations, I discovered, were telling kids that no, humanity is not separated into male and female. That's an outdated, incorrect, dangerous concept. And that there was this thing called gender, which is completely separate from biology and takes precedent over biology. So I discovered this all the way back in 2008, 2009, and I warned parents in my book that this was just going to be a disaster for our children. You cannot tell kids this. You cannot tell children that there are other options besides male and female. It's simply not true. And it's going to undermine the child's sense of a strong internal identity, a sense of self, which is so important for developing kids and adolescents and young adults. So that was all the way back a long time ago. Unfortunately, it took this current calamity that we're now experiencing of a 5,000% increase in the number of kids who are confused about who they are on a very, very deep level.
Yeah.
There's really nothing closer to the core of our humanity than male or female. And these unfortunate kids who don't know any better are being led down a dangerous path. And so I see these kids and their families in my office for the past few years. I've talked to hundreds of parents and dozens of kids who are dealing with this issue. And I can tell you that it is a man-made catastrophe, but there's a lot that we can do about it. And so I wrote another book that came out a few months ago, and that book is called Lost in Transnation, a child psychiatrist's guide out of the madness. And that book guides families not only on how to deal with this issue if it's currently happening in their home, but it helps parents to inoculate their kids against it. I want kids to be prepared from a young age to be able to recognize the misinformation that is so rampant and that they're going to hear at school from their teachers, their guidance counselors, perhaps their pediatrician, their therapist, certainly from the media, from Hollywood, from our government. Kids have to be inoculated. So that's what the book is about.
So a number of things come to mind, which is, I think everybody has a question of how this happened so quickly. So, you were seeing signs of it in 2008. I think the general public probably didn't really see this until the last few years. And, 5 years ago, there was, 15,000, I think the number, 15,000 diagnoses of gender dysphoria for ages 6 to 17. Last year, there's 42,000. So, tripling the number in just the last 5 years. And it's very clearly I call it a social contagion, right? It's like any trend, you see people wearing certain clothes, you want to wear those clothes. You see people opening their minds to this new ideology, think it's cool. It might explain some of the weird sensations or emotions that you're having, some of the emotional problems that you're having. You're desperate for a solution and an answer, and so you default to that. Is there an easy answer to why that's happened, or is it just social media and the natural way human events spread?
Well, first, I want to clarify something, Congressman, and that is that there are different populations that suffer from having a discomfort with their sex. And we are speaking here of a particular population. We're not talking about middle-aged heterosexual men that after having their families and cross-dressing for a long time decide to live their lives as women. We're not talking about people, such as Admiral Dr. Levine and others. We're also not talking about the kids who present at a very, very young age. We're talking about kids who are just entering adolescence, or they are in adolescence, or they are young adults without any history of being uncomfortable with who they are. And we are calling this rapid onset gender dysphoria, ROGD. And it is something we never saw before.
When did that term become a thing?
Well, that term was first used by a doctor researcher from Brown University by the name of Lisa Lippman And she recognized that in her community, there were these groups of friend groups in which a whole bunch of them, if not all of them, were declaring this new identity, which was something, this was a demographic, we just never saw this. We would see individual, extremely rare cases. Let me explain. 20 years ago, we had 3 clinics to deal with these young people who had this problem. One in Toronto, one in Boston, Toronto, London, and Amsterdam. In the whole world, because they were only, we would see these is like one in many tens of thousands of kids. Mm-hmm. It was extraordinarily rare. I never expected to see someone with gender dysphoria, or what we used to call gender identity disorder, in my entire career. And now that is all I do in my office. So yes, it's been an explosion. The term social contagion was coined at the term rapid onset gender dysphoria was coined by Lisa Littman. And
gotcha. Social contagion, that's mine. I claim that one.
Contagion, I'll explain, is when feelings or beliefs or behaviors spread among a social group. Mm-hmm. And we know that teen girls are especially vulnerable to social contagions, and they can be, they can be benign. They can be a kind of haircut or a kind of makeup or shoes or what have you. But they can also be serious or dangerous: eating disorders, self-injurious behaviors, suicide attempts. And so now we have a social contagion of gender dysphoria and extreme discomfort with one's sex. And it certainly does occur in groups. We know that, we have groups of kids that are arriving in clinics like Planned Parenthood and other places. They arrive, they're like groups of kids who know each other from school or elsewhere, and they all arrive in the clinic and they all want testosterone. They all want hormones. So you have to understand that these are mostly also kids who have other psychiatric issues, other emotional issues. They are very often on the autism spectrum. They have anxiety, they have depression, they have a history of trauma. They have had difficult lives, and they have been led to believe that their feelings, their anxiety and depression, and they're not fitting in with other kids at school is because they are in the wrong body, and their problems will be solved. Their emotional problems will be cured if they go through this process that is now, in an Orwellian way, called gender affirming care, which actually means that you affirm unreality and you deny biological reality.
So if I remember the statistics correctly, I mean, that's an important point, that I think 70% of those who present themselves as gender dysphoric have these pre-existing mental or behavioral conditions, such as anxiety, suicidal thoughts, etc. That's a pretty important fact, right? And it's is that something you talk to parents about, as far as, look, you're searching for an answer for these things, keep in mind, like you may be going down the wrong path here. I mean,
well, the parents that come to me, Congressman, are parents that already realize this is not the path they want their child to go down. Mm-hmm. They may have once thought that it might have been a good idea. Perhaps they went to a gender clinic. Perhaps they were told by a clinician, do you want a dead daughter or a live son? And all those sort of manipulations, those emotional blackmails that so many parents hear. But by the time they get to my office, they are very much wanting my help in getting the child off this path. The child, however, in many instances has been so indoctrinated that they believe that anyone, especially their parents and myself, who is urging caution, who's asking questions, who's trying to educate them, are the enemy. And so it can be extremely hard to get through to the kids.
Yeah. Well, and those kids have been indoctrinated through various bogus studies that have been done. We went, because we did that hearing that I talked about earlier, I was actually waiting for that Yale doctor to come back with some of those studies, because there are studies, not that many on kids, actually, so they do conflate adult studies with children's studies, and then and use those as a way to justify transitioning children. But in our research, looking through some of those, they suffer from a great deal of problems. It's going to be very hard to have a control group with a study like this, right? It's deeply unethical. But they're often not double blind. There's often no control groups. They're the sampling, the pool of patients is not randomized. I mean, there's Correct. Really no evidence here.
Well, even those studies on adults, the results are very troubling and far from positive. So we don't even have, of course there are individuals. There are individuals that will stand up and say, this was the best thing I ever did. It saved my life.
Yeah,
and I'm not
possible.
denying that. But overall, if we try to do a study of a large number of people, we do not have a study, a good study that's well designed, that has a long-term follow-up. Part of the problem with these studies is that they might only follow people for a year. And that's not adequate. If you follow teenagers for a year until they're 20 or 21 after having these treatments and surgeries, that in no way indicates how they're going to be doing in 5 years, 10 years, 15 years, when, after they have already lived more life, they have, tried to find a life partner. They perhaps may have started to think about having biological children. There are just so many problems with the studies that are being pointed to as evidence that this is a good idea.
Is there some that come, like, so when parents come to your office and they're saying, look, we were told this, this, and this, is there something that comes up more often than other things that parents could be on the watch for, as far as like the evidence being shown to them by doctors who do a gender affirming care?
Okay, so the number one manipulation is about suicide, and the entire country, the whole population, has been misled to believe that if kids do not have access to gender affirming, so-called gender affirming puberty blockers and hormones, cross-sex hormones and surgeries, that they will commit suicide. And that is simply not true. While these kids do have an elevated rate of suicide, as well as suicidal thoughts and maybe suicidal behaviors, it's essentially the same rate. It's a very low rate, actually, but thank God, it's essentially the same rate as other kids with emotional problems. Mm-hmm. There is no uniquely elevated suicidal behavior amongst these kids. And perhaps even more important than that, we have no evidence that so-called transitioning them will lower the rate of suicide. We have no evidence of that at all. It may actually increase the rate of suicide.
Right. And they claim they do have evidence, right? And which is, but again, it goes back to the way that they construct some of these studies, and it's the selection process. They select only people who happily chose to be part of the survey that they give out, which is of course, that's not an objective way to settle this. Doesn't take into account people who maybe opted out of a transition because they saw it wasn't going well. It's very tricky statistics that they use, and I think people need to be aware of. I want to move on to another question that you talk about, I think, in your book. Proactive.
I just want to add one thing. I'm sorry. It's true. I mean, not everyone can sit down and analyze the data, obviously, but that's already been done. It's been done by many countries in Europe and medical authorities in the United Kingdom, Sweden, Norway, Finland, and Denmark, which are progressive, LGBT, very friendly countries. And their medical authorities have analyzed the data, and they have come out and said, we don't have evidence of that it helps, but we do have evidence that it can harm. And so all those countries have severely restricted the access of the gender-affirming care that we in this country and Canada are calling life-saving. So those countries have severely restricted the access to those medical interventions, while we over here, it's just the most bizarre thing that we're living through right now. It's Twilight Zone. I mean, our country and Canada are outliers. And those medical authorities in Europe are looking at us and saying, what are you doing over here? There's no evidence for what you're doing.
What, again, go back to helping parents through this. You talk about proactively putting your school on notice, telling them you don't give them permission to socially transition your child. So how exactly can parents do that?
Okay, really important. Parents have the constitutional right to direct the education and upbringing of their children. The schools do not have that right. They're acting like they do, but they do not. Now, parents need to be informed of their rights. I have an entire chapter on schools that will open up the eyes of parents so that they understand what's going on in the schools, what their kids are being taught, what they're being told by social workers and guidance counselors, et cetera, possibly behind their backs. And I have an entire an appendix. I have 7 appendices in the book. One of them is specifically on schools, written by attorneys that are specialists in this area, instructing parents on what they can do. Now, of course, I want everyone to read my book, but even without reading my book, you can just go to my website, miriamgrossmanmd.com, and you can download a form, a PDF that you can print out to give to your school. It will put your school on notice saying that your family does not agree with gender ideology. You do not give permission for your child to be exposed to gender ideology, whether it's in the classroom or at an assembly or at an after-school club or what have you. You certainly do not give your permission for your child to use a different name, pronouns, opposite sex, bathrooms, etc. And you are putting the school on notice. And I want parents to download that form and present it to the principal of their school, even if your child is just entering kindergarten. You can't do it too early, because even we know that there are books for kindergartners, books that are read to preschoolers that are just full of this falsehoods about being a boy and girl, that tell children that adults sometimes make mistakes, and only you know if you're a girl or a boy, and you have the right to announce that, and everyone is obligated to honor your decision. They are telling this to very small children. So you, parents, have to reach your child first. Your child has to know that they're going to learn about these truths and about your family values at home. They should come to you with their questions. when they don't understand, when they hear something unusual at school, when they hear the phrase sex assigned at birth. No, as I said in that, when I testified, at that committee in the House of Representatives, it was one of the first things that I said, because Dr. McNamara, the physician from Yale who was arguing for gender affirming care, on and on was using the term sex assigned at birth. No.
Right. Yeah.
Sex is established, permanently established at conception. And I want even little children to understand that. And there's no reason why a 3 or 4-year-old can't be told, you have been a boy since the very moment you existed, when you were still inside your mommy, before you came out, and there was no doctor or nurse that made a decision about calling you a boy or a girl.
Yeah. They weaponize words, and they normalize these phrases like, gender assigned at birth. And it's part of the process to sort of get you to this point where it all just seems normal and like something you should just keep saying. Have you met any other pediatricians who you knew to be normal, believing in normal things at one point in their career, and then they themselves transitioned into this belief system where they started using phrases like this? Do you have any relationships like that? Because I think all of us continue to struggle with the how. How do you go from, because I told my Democrat colleagues during those hearings, I'm like, you guys didn't believe in any of this 5 minutes ago. Give me a break. Like, you didn't. and now you do all of a sudden. Do they make themselves believe it? Do we even have an explanation for that?
Yes, I'll tell you how it happens. Well, first of all, I'm a child psychiatrist. I did do some training in pediatrics, but I'm a child psychiatrist. So the way it happens is that there's institutional capture. The American Academy of Pediatrics has been captured for a long time now by ideologues. And what happens is that these activists who feel very, very strongly about promoting these beliefs, and it is a belief system, it's not based in medicine or science. What they do is that they get control of the committees. It's probably very similar in Congress, I guess. Yeah. They get control of the committees that are going to be making decisions about policy. And parents need to know, and I explain this in my book, that when the American Academy of Pediatrics comes out and says that gender affirming care is the only way, and that not only that, but that when, if your child comes to you and wants to use a different name, opposite sex name or pronouns, that you should immediately go along with it. There has been no referendum of pediatricians or child psychiatrists asking them that. There has been no vote or debate. To the contrary, they come out and act as if there's a consensus, but what there is opinions that have been silenced. A great many doctors actually, well, I don't know about a great many, but a good number of doctors have been brave enough to stand up and to oppose this and to say, hold on, we are sterilizing children. We should be debating this. There's a lot to talk about here.
Well, and what's also interesting in your book chapter, I mean, you start your book out talking about the development of this idea of gender identity, which is, would you say, is the brainchild of a child abuser and pro-incest psychologist, John Money. What a name, John Money, for being a sociopath as well. So what's the story? What's the story there? And there's always an origin. I was going to ask you before, like, who's patient zero here in this disease? And apparently it's this guy.
Well, we could spend a whole hour on this, but just briefly, patient zero would be a boy by the name of Bruce Reamer, and he was one of a pair of twins who in the 60s, when they underwent circumcisions, there was a terrible accident, and Bruce's penis was burnt off in the process. his parents heard about a professor at Johns Hopkins University by the name of John Money, who had a theory, although he was presenting it as fact, but his theory was that a boy could be raised as a girl and vice versa if you just reach them early enough, because he argued for his entire life that biology was essentially irrelevant, and that our identity as male and female was something that was imposed on us by our culture. So again, it's kind of a long, complicated story, but he told the parents of this boy to raise him, to castrate him, to have him castrated, to have his testicles removed, and to raise him as a girl, and then to give him hormones and surgery as he entered adolescence, so he would have the genitals and the secondary sex characteristics like breasts and so on of a girl. And they went with it. They saw it as their only solution at the time. Money reported it as a success. He acquired tremendous fame. He claimed, both in the professional literature and in the lay press, of course, made a very, very big deal about this, that essentially that nurture was more important than nature, that the way people are raised, children are raised, is more important than their chromosomes and their genitalia. This was huge, huge stuff in the 60s and 70s during feminism. Well, P.S., it was a complete disaster the whole time from the beginning. The boy was never comfortable as a girl at all. He was extremely masculine in everything that he did. And mind you, he was always told that he was a girl from the age of 18 months. So, this really was the perfect experiment, the perfect, proof of concept for John Money's theory. But we only found out in the late 90s that it had been a catastrophe. So all those decades, people were under the impression, doctors, parents, surgeons, psychologists were all under the impression that his experiment had been a success. And this had very deep, significant ramifications in our universities, in the medical profession, and in the mental health profession. And unfortunately, it continues like that. And more people need to know the story of those twins. I tell the story in my book. And there's also an incredible book by John Colapinto called As Nature Made Him, the boy that was raised as a girl. But anyway, that is patient zero. Congressman, he ended up committing suicide. He was told at the age of 14 that he was a boy, that he had been born a boy. And he immediately, at once, returned to living as a boy, stopped taking estrogen, and lived as a man until his, I think, late 30s. He had been sexually abused by Dr. Money. He had been lied to. I mean, it was just horrible. So he did kill himself, sadly, as did his twin, died of an overdose. And what this shows you, this story, is the arrogance of a professional, with a white jacket, with a lot of diplomas on the wall, at an esteemed university, pushing his theory for his own reasons, for his own, fame and fortune.
Wow. That's incredible. I don't think a lot of people know that story, and that there is really actually some kind of origin to this madness. There always is. It's sometimes hard to draw back to it, but he did that. Well, it's a great book. Especially for parents who know that this stuff is wrong. Look, like, I think 90% of the public just has an intrinsic sense that this stuff doesn't make any sense, but they don't always have the arguments. They don't always know if their kid is coming to them from school This is a problem on all subjects, by the way, for parents these days, because your kids have access to the internet and all sorts of crazy ideas. And so they come back and they're like, blah, 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 something crazy. And as a parent, you're like, I know that's not really true, but I don't know the details because I didn't expect you to say something so specific. It's like when people come with me, well, Dan, I have this research paper and this says that. So what do you say to that? And I'm like, well, man, I haven't read the research paper. So, give me a little bit. And that, I bet parents deal with that all the time with kids coming home from school. And so this gives you the tools to actually know what to say.
I don't want parents to be blindsided like so many families that come to me. They are blind. They don't expect it. You don't expect your girl, who's always been happy being a girl, to sit you down one day and say, no, I'm not a girl, I'm a boy. I want you, as of now, to please call me Jeffrey and he, him. So a lot of parents are blindsided, and that is what we do not want. This is a battle. You have to understand the battlefield. You have to understand that, that there's minds out there. And so I wrote the book, and I really put my heart and soul into it, I have to say, because I've seen so much suffering. I've seen too much. And I want parents to be prepared. And this really is a guidebook on how to understand this whole thing, how to make sense of it, how to know how to inoculate your children, understand why the medical profession is saying what they currently say, why the government is, what's happening in the legal system. It's just essential for parents.
Well, it's great. And thank you for your service on the subject, Dr. Miriam Grossman. Thank you for your testimony in Congress. I think it went rather well, and we're going to continue having that debate in Washington, D.C. and try to reverse this trend. And thank you for what you've done. And
Welcome.
It's been an educating conversation.
Well, listen, we need a few days of congressional hearings, not just a morning, a few days in which we call up, we get all the heads of these organizations, the medical organizations, educational organizations, sex educators, and we put them on the hot seat and they have to answer the questions. Why have they done this? Why are they leading children down a dangerous path?
Yeah, I absolutely agree. They won't come, I bet, or they'll cite some nonsense studies that we'll be ready to debunk. Dr. Miriam Grossman, thank you so much for being on.
Thank you, Congressman, for having me.